So a couple of days back I saw a patient, a couple in fact. The complaint was that the male partner was quite comfortable with the masturbation, and he would indulge in masturbation quite frequently, once in a day or once in 2 days, but his desire for sexual activity was almost non-existent. So he would prefer masturbation over normal partner sexual activity, and this thing had been continuing for quite some time, and it was a cause of distress for both the patient as well as the wife. The couple was distressed about it, and they were seeking consultation for the same problem. And this is not one-off patient. We often see such clients where usually the men becomes more comfortable with masturbation and they start preferring masturbation over the sexual activity. So what can be done about this? We have made multiple videos in the past where we say that masturbation is not an illness. Masturbation is not an unhealthy habit. That said, there are certain conditions where masturbation is not considered healthy, and one of those conditions is when the masturbation starts replacing partner sexual activity, and that leads to distress in the patient as well as the partner. So in this particular case, masturbation would be considered as unhealthy. Now what usually happens is men especially, they start masturbation at during their adolescence ages. They start masturbation by the time they turn 14-15, and over the years men tend to become very comfortable with that whole act. There is no performance pressure. They know what pornography to watch, what erotic literature to read, and they have a whole system set as far as the masturbation is concerned. And after many years, when they get a partner, when the partner sexual activity starts, it comes with its own challenges. When you are doing sexual activity with a partner, it is usually more pleasurable, but at the same time there is more pressure. There is more of performance anxiety, the pressure to perform. And if things do not go the right way, if there is a problem in achieving good erection, or if the ejaculation happens too early, or if there is desire issue, in certain individuals what happens is they start avoiding the partner sexual activity. The thought comes that whenever they have to prepare for sexual activity, the thought starts coming, what if it doesn't go the right way? What if I'm not able to achieve good erection? What if ejaculation happens early? What will the girlfriend say? What will the wife say? And all those thoughts and all that pressure kind of starts them pushing away from the partner sexual activity. They start avoiding it, and then a vicious cycle sets in. Whatever sexual desire they have, that gets released in masturbation, and they are avoiding sexual activity. So the more they avoid sexual activity, the lesser the confidence is, and the lesser the confidence is, the more they indulge in masturbation at the cost of sexual activity. So finally a situation arises where the sexual activity with the partner is almost non-existent, and the only sexual thing that is happening is masturbation. So this is a problem, and this is the situation where most of these couples seek medical help. Now we have to remember a couple of things. As I said, masturbation in itself is not abnormal, but when it starts replacing the partner sexual activity, then definitely it is not considered healthy. And we should always remember this thing that sexual activity is a thing of rhythm. If you are doing sexual activity regularly, and if you become comfortable with it, it is nothing that would cause distress to you ever. But at the same time, it must be remembered that like any other body function, there would be times when sexual activity would not go as desired. You may have difficulty in achieving erection, you may have early ejaculation, something may happen, and you should not get too bothered about it. If it happens once in a while, you should be able to tell yourself that these things happen. Once in a while it may happen, and you should never allow avoidance to set in. If you start avoiding sexual activity, the sexual functioning would only become worse, the problem would only multiply. And if you start avoiding the sexual activity and start preferring masturbation over it, things would only complicate. So in such cases, we tell the individuals that please cut down on masturbation, please do not avoid partner sexual activity. In some cases, some medications are also used to just support the person, support the sexual functioning, because what is usually seen is if with support the person is able to restart the normal sexual activity, get into that rhythm, then after some time he is able to sustain it on his own, and all the medical support can be gradually decreased and withdrawn. So these things happen, it's a common problem, and in case you or your partner is having such issue, please don't shy away from seeking help from a proper medical practitioner. These things require a little bit of adjustment to get back on track, but if left on their own, if these things are pushed under the carpet, they may only become worse. So friends, this whole platform of mesolves has been created to impart sexual knowledge, to impart the sexual education, and if you like such content, you can definitely join us. Thank you.